Great. Okay, well, good evening, everybody. Sorry for the delay. We had some, as usual, technical difficulties. But we want to welcome you all, and we hope to the one of first of several webinars that the American College of Surgeons plans to host in providing national mentorship to medical students particularly interested in the surgical career. My name is Stephen Yang. I'm chair of the Committee on Medical Student Education for the American College of Surgeons. I'm also a thoracic surgeon at the Johns Hopkins Hospital. I first want to thank you all, the students, perhaps some faculty, for coming on this evening. We've had an extremely overwhelming response in the number making reservations to this webinar. And if you've not already done so, please answer the polling questions so it will provide some direction to our discussions tonight. We also want to make this as interactive as possible and benefit you all. So please add some comments in the comments screen so that we can try to answer these at the end of our talks. We know normally during this time of year, students are full of excitement preparing their applications for a surgical residency. If that was not enough of a difficult process, the pandemic has undoubtedly added unnecessary stress, many complexities and obstacles this year. We hope to provide some general guidance and hopefully allay some fears. If your institution is like mine and you, the students, will be welcomed back to clinical rotation soon, make sure you go back with a new sense of purpose. Thank the many volunteers, the frontline folks. Be tolerant that patient care is not the same, and take advantage of the many innovations your faculty have made to restore some normalcy in your curriculum. Many students will fear contact with COVID patients, but remember, as we think back and decided to choose this medical profession, we want to help our fellow humankind no matter the situation. Next slide, please. On this panel tonight, we have the leaders in surgical education who bring their different experiences and perspectives to the residency application process. Before I ask the panelists to briefly introduce themselves, I would like to personally thank Dr. Sachdeva, Director of the Division of Education for the American College of Surgeons, an icon, a figurehead in surgical education for over a quarter century, and has devoted his life particularly in developing programs like this specifically for medical students. And not on the panel tonight, but always virtually around is his Associate Director of the Division of Education, Patrice Blair. So we thank them both for this opportunity tonight. I'd first also like to invite the panelists to briefly introduce themselves and who they are. Dr. Sachdeva.
Thank you very much, Dr. Yang. And on behalf of the Division of Education at the American College of Surgeons in Chicago, I would like to welcome all of you to this very special seminar series. As Dr. Yang has mentioned, a lot has changed around us and a lot continues to change. But what remains stable and constant is our commitment to our patients and our passion for surgery. We hope that you will find this seminar series helpful as you plan your surgical careers, and the panelists will help you steer your various activities during the fourth year of medical school as you embark on this very exciting journey and you enter the surgical profession. We are delighted to have you part of our profession. I would like to thank Dr. Yang for organizing this symposium, and also the distinguished faculty who he will introduce momentarily. And we look forward to your feedback. I hope you enjoyed the seminar. And once again, thank you for being part of the seminar this evening. Enjoy. Thank you.
Well, thank you, Dr. Sachdeva, again for your mentorship and leadership. I would also be remiss if I did not acknowledge the hardest working staff for the American College of Surgeons, Kim Eschert, Brett Aiken, Sangham Ratsavong, and Olivier Pentano for their immense work in setting up this webinar. They stayed up late these past few nights answering my emails, ensuring the smooth performance of the Zoom meeting. So I'd like to go around the virtual committee and have them introduce themselves. and maybe briefly tell them their point of view in this application process. So I'll talk, Dr. Moore, if you can introduce yourself first.
Sure, thanks. Good evening. I'm Jesse Moore. I'm a colon and rectal surgeon. I'm at the University of Vermont Medical Center in Burlington, Vermont. And I'm going to share the perspective of the clerkship director and somebody who does a lot of advising for students who are interested in pursuing surgery as a career.
Thank you. Next is Dr. Sudan.
I'm Ranjan Sudan, and I'm the Vice Chair for Education at Duke University. But importantly, I've also served as a consultant to the American College of Surgeons, looking across the various offerings for medical students and residents, and I'll be bringing that perspective to you. I've also been instrumental in developing the medical student core curriculum. This is a project, it's almost a labor of love over the last 7 years or so. And I'll be speaking about that in my section of the talk this evening.
Great, thanks, Ranjan. Dr. Choi?
Hello, I'm Jennifer Choi. I'm the program director at Indiana University. Although I am very involved in the Association for Program Directors in Surgery, tonight I'll be giving perspectives that are largely my own and those of people that I've talked to, but not in an official capacity for the APDS. But certainly I've had the privilege of advising many students as well as interviewing many, and am actively in the process of planning for this year's recruitment season. So I look forward to sharing my perspectives as well this evening.
Great. And last but not least, Dr. Schnartz.
Hi, my name is PJ Schnartz. I am a trauma surgeon and a vice chair here at the University of Nebraska in Omaha. I'm also the vice chair of the medical student committee from the American College of Surgeons, past president of the Association of Program Directors, and a two-time board member of the Association for Surgical Education. I'd really like to welcome you personally, each one of you, to what really is an exciting career. This is an unusual first step, so I appreciate you bearing with us. My goal for tonight is really to provide you some assistance from the standpoint of a program director, as well as some experience as a clerkship director and advisor. So welcome aboard. It's good to have you.
Thanks, PJ. And then briefly, I'm a thoracic surgeon, so I am a little bit different from all of my colleagues from below the diaphragm. But I have served as program director here at Johns Hopkins for the cardiothoracic surgical training program. I've been with the ASC. I was a past clerkship director at Hopkins. I also sit on the American Board of Thoracic Surgery, as well as the Residency Review Committee. So we're actively interviewing students in cardiothoracic surgery for the integrated program. So I'll have a different perspective, maybe from a specialty standpoint. Next slide, please. So I'd like to start the program. So briefly, again, each one of our speakers are going to give a short presentation about these topics tonight. And then we'll open the floor up for the comments and try to go through the questions. And then we'll have some closing remarks. And so I'd first like to introduce Dr. Jesse Moore from the University of Vermont. And Jesse will talk a little bit about current challenges from the clerkship standpoint.
Great, thanks, Dr. Yang. We can move to the next slide. And it looks like, oh, I can move it to the next slide. Okay. Okay, so these are the things we're gonna go over for the overall webinar, our goals and our objectives. We can go to the next slide. And it says I can control, there we go. Okay, one more click, please. Great. Okay, so we're going to talk briefly about which parts of your application matter the most at this point, and then specifically how COVID-19 is impacting that. And then also I'll review the typical fourth-year timeline, and again, how COVID has shifted that for everybody. You can click the next. we're specifically going to talk about the STEP scores, clerkship honors, letters of recommendations, and then interviews. And we'll go to the next slide. Okay, so a lot of the data that I'm going to show you comes from the NRMP Program Director Survey. This is something that they send out every 2 years, so we don't have it for 2020 yet, so this is the most recent data we have. And they send it out to program directors from every specialty. And I'm going to show you some figures from the general surgery portion here. This is the results of the percentage of program directors that are citing factors when they're thinking about selecting applicants to interview. And so there were 100 program directors that responded to this. And what you can see is that step one is really cited by a lot of program directors, and it has a really high importance to them. That's usually because it's used as a sorting tool. We know that most of you have already taken step one, and it's not something that you can change now. The good news is it's also not impacted by COVID-19. The next slide. Great. So step two is probably something that many of you have not had a chance to take yet, particularly because of COVID-19. It is still important for you to be thinking about step two, and that's because about 2/3 still are requiring it when students are applying, and 58% actually have a target score that they're looking for. So this is still going to be under your control. My general advice to you is that your timing of step two really depends on how you did on step one. So if your step one score is significantly above the average for a student going into general surgery, which is about 230, then you don't need to do it early. You don't need to do it right now or in June. You can be focusing on doing sub-internships or acting internships and getting really good letters of recommendation, and you can do step two a little bit later in the summer. If your score on step one is more around the average, then you might want to think about doing it a little bit sooner, maybe midsummer, so that you have that result back on step two, and so that can help you think about how you're going to, which programs you're going to apply to and which programs you're going to be most competitive at. If you're interested in surgery and your step one score is well below average, so if you're 220 or lower, then my advice is to take step two as soon as you can, so that you can see how you perform. And if you can really get that score up and well above average for step two, that's really going to have an impact on where you can apply. If you score lower than average on step two, then you're going to need to be thinking with your advisor about having a backup plan, because it's going to be harder for you to match into general surgery. So step two is still going to be something that you have under your control, and you need to think about your timing. Next slide. So honors in surgery, this is an expanded view of that figure from the program director survey. And you can see that honors grades in a clerkship in the desired specialty is down a little ways. It's 76% of program directors find that it's important, and 4.2 average rating. So it's kind of middle of the pack in terms of selecting applicants. This is also because most of you have done your clerkships. This is no longer under your control. But I wanted to put this in here because I get questions every year from students saying, I didn't get an honors in surgery. Is there any way that I'm going to be able to match? And my answer is categorically yes, absolutely. Remember that nationally, honors is only given out to 25 to 35% of students around the country on average. And so not getting honors in surgery does not mean that you don't have a chance. So don't panic, and I don't think that COVID-19 changes how the program directors are going to look at this piece of data on your application. Next slide. So letters of recommendation, this is really an area where you have a real opportunity to have a big impact on how your application is viewed. These two figures, one is for selecting applicants and the other one, the bottom one, is for ranking applicants. And what you can see is that letters of recommendation for selecting applicants is the second most important factor. It's huge. After they look at that step 1 score and use that to sort their pile, next thing that they look at as a program director is the letters of recommendation. In terms of ranking, it does move down some. That's because the interview moves up and how you do on your interview moves up a lot, but it's still really, really important. The good news is your ability to get a great letter of recommendation is still under your control. Next slide. So what do you need to know about how to get a great letter of recommendation? First of all, how many do you need? I advise most students that they should have on average 3 or 4. Not every program, there's no specific number, and each program is going to have their own set requirements. There's no universal requirement, but if you have 3 or 4 letters, you should be okay. I have an asterisk next to that because that's how I typically advise students. And this is something that in the COVID year, it's certainly possible that you're not going to be able to get as many letters of recommendation, and program directors, I think, are going to be understanding of that. So this is a guideline, but it's not a hard and fast rule. Who should write your letters of recommendation? Your surgical faculty write you better letters. So I'm going to speak a little bit more about audition electives in a moment, but don't feel panicked because you don't have an audition elective to get a letter of recommendation. Your faculty are invested in your future and your success, and they're going to write you great letters. Typically, you want to try and get those from acting internship or sub-internship faculty. Program directors really want to hear from those faculty who are working with you when you have more responsibility than you typically had in a clerkship. That being said, clerkship, normally not something where you want to get a letter from, but this year, again, I put an asterisk there because if you can get a great letter and that ends up being your 3rd or your 4th letter from somebody who you worked with in the clerkship, that's probably going to be okay this year and understood. I still think it's probably a good idea to stay away from asking residents from letters and make sure that they're from full faculty. And finally, research faculty, particularly if you're applying to a program that has a lot of focus on research. If you've done a bunch of research and you have a great relationship, then that's a good letter to get. And similarly, community surgeons write some fantastic letters. I've read a lot of great letters from community surgeons. So don't feel like just because you're not in an academic center that you can't get a great letter. You certainly can. Okay. How do you go about getting a good letter? Well, you want to figure out when you start that rotation who the faculty is that you're going to target, and then you want to work with them. You want to go to their clinic, you want to be in their OR, you want to know everything about their patients. You want to work really hard for the residents if there's residents on that service, because usually what happens is at some point during your month, the faculty says to the resident, hey, how's this kid doing? And that's going to impact how that letter is. So work hard for the residents because that information will trickle up to the faculty. I typically try and recommend that you ask in the 3rd week. I think that's a good time because that way if the faculty haven't already figured out that you're looking for a letter, it gets you on their radar and they're going to pay more attention to your performance in that 3rd week and then that 4th week of your acting internship. And there's an asterisk there, and I'll come back to that when I show you the timeline. Okay, so the interview. The interview is really, really critical when it comes down to the program directors putting together that rank list. You can see that the top factors, the top 4 factors that go into that rank all come from the interview. So how do you make sure that you're going to get a good interview? Well, it really starts with where you apply. You need to determine your goals right now. You need to decide if you want to be the next NIH-funded chair of surgery at a major academic center, or if you want to be a community surgeon with a bread and butter practice. And that's going to determine the kinds of programs that you're going to apply to. you need to be brutally honest about your qualifications. And this really comes from getting a good advisor now, more than any other year. Get a good advisor and meet with them frequently, talk with them about your goals and your qualifications so that they can really guide you on programs that you should apply to that are going to be within your reach. I advise students to pick 25 to 30 programs. 2 to 5 of them should be your reach programs, 15 to 20 that are realistic, and then 2 to 5 that are safety. And then in a typical year, plan on about 12 to 17 interviews. It really gets logistically hard to do much more than that with the travel requirements. This year, interviews are probably going to be different because I expect a lot will probably be done virtually. So that may actually allow you to interview at some more programs. Audition electives. Every year, my students say to me, do I need to go do an audition? Should I do an away elective? And I say, you should do an audition or an away elective for 2 reasons. Number one, you want to have an adventure. So the students up here, they've worked at a lot of, in a relatively rural setting. I say, if you want to go and do a bunch of penetrating trauma in Miami, or you want to do liver transplants all night long, then go to Michigan, right, where they do a ton of liver transplants. Or if there's an area in the country that you're really interested in checking out, then I think that's also a really good reason to do an audition elective. But in terms of actually selecting applicants to interview, you can see that for general surgery, an audition elective or rotation within the department is not really that important to about half. And this is really different than ENT and orthopedics, where the numbers are much, much higher. So you may have colleagues who are interested in these subspecialties who are freaking out right now because they don't have the ability to do audition electives. That's okay. In general surgery, it's not a critical factor. So I don't want you to be worried about that. When it comes to ranking applicants, look, it goes down to 36% from 48. So even fewer consider it important when they come to ranking. Okay. So the last thing to talk about is the timeline. So this is the typical timeline as things were in the pre-COVID era. So you would have been doing your AIs in your step 2 starting in April and being done by probably mid-September or October, because ERAS opens to programs typically around the middle of September. And then the MISP, or your Dean's Letter, comes out October 1st. You'd be working on applications here. And then typically interviews would be November, December, and January. It's going to be different this year. And so everything is shifted, right? The hospitals have all been closed, and so students are just getting back in. And so your AIs in step 2, you've lost some time there. The good news is that ERAS has just made a change, and they're going to open to programs, and the MISP are going to be released almost, 6 weeks later than normal. And so that's going to give you more time to do those AIs and to work on your application. So that's the good news, is that everybody recognized that your time was constrained, and they've added some time in for that. The challenge is that that is going to pinch in on some of the time that would traditionally be used for interviews. But I think what we're going to see is that there's going to be more opportunity for virtual interviews. And so hopefully this won't have a big negative impact. So those are my key takeaway points, and I'll look forward to answering any questions.
Great, thanks, Jess. Next I'll have Dr. Sudan come from Duke University. He'll talk a little bit about the medical student core curriculum, where he's been integral in leading the efforts in putting these online. So Ranjan?
Yeah, thank you, Steve. I want to emphasize a few things that Dr. Moore had said. One of the things that Jesse emphasized is the letter of recommendation. And you certainly can work hard to get a good letter of recommendation, but I think it's also important to develop some good substance. And that substance really comes across as you being a competent medical student, and it will enhance your ability to get a good recommendation letter. We know that the clerkship has been disrupted over the last few months because of COVID. And so there likely is going to be variability both in knowledge and skills. of medical students now going into their sub-Is. So these resources are really designed to help maybe make up some of those gaps that you have. One of the good places to start is the educational resources for medical students that is available on the American College of Surgeons website. This has many different curricula that you can access, but it also talks about what is the life of a surgeon like, how do you write a good personal statement. It talks about different residency programs and their characteristics. There's only one caveat to that, which is that some of this information may be a little bit dated, so please be careful when you read the letters, but there's still a lot of very good information in there. And so I would highly recommend you visiting that page for some very good general information. Most of that information has been developed by the Committee on Medical Student Education and has been written specifically for you. The second resource that I want to talk about, and I'll actually spend a little bit of time on it, so I won't spend time on this slide, is the Medical Student Core Curriculum. The third curricula that is available through the American College of Surgeons website is the Simulation-Based Surgical Skills Curriculum, and I'll spend a couple of minutes on that as well. And this is an offering that is time-limited. It's the introductory cases of the ACS Fundamentals of Surgery curriculum for medical students. This is typically available to students after they have matched and is accessible through the program directors. But until the end of the month, there are certain cases that are available to you. And I'll show you those cases. And this really helps you with decision-making skills. And So You Want to Be a Surgeon is also a nice resource for you to be able to look through. Can we go to the next slide, please? Thank you. So I'll talk a little bit about the ACS ASC Medical Student Core Curriculum. This has been a product in making for the last 7 or 8 years and is a product of the Association for Surgical Education and the American College of Surgeons. These essentialist surgical topics were identified through an extensive needs assessment. And these are what most students had identified, as well as clerkship directors and program directors had identified as topics that were essential for every medical student to know. So around this, we have developed goals and objectives. And these goals and objectives are a page, page and a half, and they very well describe what are the most important things about that particular topic that you must know. And it gives some teaching hints and learning hints. There are some practice questions associated with it as well. And then to address the goals and objectives, there is content that is available. Can we go to the next slide, please? So the content that is available really speaks to those goals and objectives. And these are the various topics that are available. The way I would suggest you use this is if you look at the goals and objectives and you identify there may be some gaps in your knowledge, then you can look at the content and really buff up your knowledge using these goals and objectives and content. What's important to understand is that this is not encyclopedic knowledge. This is not like a textbook. These are the most essential things that you must know on this particular topic. So I think this is a very good resource and it's to the point. It is relatively short. What we'll be doing is starting sometime in June, perhaps around the second week of June, we'll be broadcasting through the American College of Surgeons seminars that will be tutorials on these various topics. So I would encourage you to be on the lookout for that and sign up for those topics in particular that you feel you need to improve your knowledge. Can we go to the next slide, please? This is another curriculum that I wanted to speak to you about. This is the American College of Surgeons Association for Surgical Education Medical Student Simulation-Based curriculum. And this really has a number of different modules and is designed for all 4 years of medical school, all the way from year 1 to year 4. It is typically designed to be implemented in the simulation lab. But the way you can implement this is if you want to learn some suturing skills, for instance, you can certainly go to the suturing module, or you can go to the nasogastric tube or the Foley catheter module. and then practice these either on a suturing pad or even models once your simulation center becomes available and open to you. So this is really a very good curriculum as well for you to be able to follow. You don't have to learn every skill there. It's a modular system, so you can pick and choose the skills that you want to develop. And they go all the way from history and physical of the abdomen, all the way to central lines, etc. So if you feel like, for instance, when you're reading the cognitive part of the curriculum that you really need to buff up on your abdominal examination skills, then you can go to this particular curriculum and find out as to how you can improve upon those skills. So this way you will be improving both your cognitive knowledge as well as your skills, and that will make you a more effective sub-I. Can we go to the next slide, please? This is the introduction to the American College of Surgeons Fundamental of Surgery curriculum for medical students. There are a number of cases here. This is really an interactive case-based scenario system where it will walk you through scenarios and will help you develop your patient management skills. So you not only now have cognitive knowledge, you're working on developing skills, but then this is really addressing more patient management and some decision making. So these are just examples of what is available through the American College of Surgeons website. This is all free to you, and this particular program in particular is only available till May 31st currently. I think that may be it. Thank you so much.
Well, thanks, Ranjan. Again, Dr. Sudan was co-chair and instrumental in getting these curriculum together from the time of doing a needs assessment and trying to figure out the topics on that one slide to actually filling the content. So we all want to thank him for his leadership. For the next couple of minutes, I'll have Dr. Choi and Dr. Schnartz talk about perspectives from a program director's point of view. Dr. Choi.
All right. Thank you, everyone, for all of the great advice that has been given ahead of us. Program directors really are a practical bunch. And so I think that in light of COVID-19, you will see that we have made some modifications in our expectations, and hopefully those will be well communicated, particularly as the next month or two progress, and as we know a little bit more and understand a little bit more about how our processes, individual programs will work. I want to reiterate a few things that Dr. Sudan and Dr. Moore have already talked about, and that is the value of your sub-Is and elective surgery experiences. As program directors, one thing that we really value is teamwork, interprofessional activities, and demonstration of emotional intelligence. And those things really come out strongly in your letters whenever you are able to participate actively in your team, whenever you take excellent care of your patients, and whenever you fully engage in the full immersion experience that your sub-I or your elective experience offers. So while you want to impress the person that is writing your letter, by all means, we strongly implore you to really participate fully in the care of the patients, because really what we want to know as program directors is that you love surgery and that you will be able to fully engage and handle the rigors of the residency program. And so being able to do that on your elective rotations will be really important. PJ, do you have any comments on that?
No, not on that, but I agree with what's exactly been said. With respect to away rotations, I pretty much agree with what Jesse Moore said. You know, in general surgery, they are not required. And the advice I'd give my students is really to proceed with an away rotation with some trepidation. In some ways, because it's not as important in the general surgery world, a lot of times if you're just average, you can really hurt yourself more than help yourself. I do think there's a few times when an away rotation is helpful. One if you have family in the area and you're thinking of moving to that area and you really want to get an unvarnished look at it, then that's okay too. I agree with Jesse. If you're going to have an exam, you're going to go have an adventure. If you've worked in the Southeast and you've never been in the Northwest and you want to see what that's like. And I think the third time might be if you're couples matching and you don't want to break apart your family and you want to sort of get a view from both sides of the relationship, what a place might be. But by and large, one of the things you'll find is all of your medical school training is really all you need to succeed in a general surgery interview. So I agree with mostly what's been said so far.
So from the standpoint of away rotations, we know that the recent statement really tries to discourage away rotations. So that's why my final point is to consider local advocates. So if there is a situation that Dr. Schnartz mentioned, particularly the situation of a couples match or a particular part of the country where someone might not be likely to take a look at your application because you're from another part of the country, oftentimes there are people within your medical school that can help connect you with those institutions, and many of us are very willing to do that for our medical students. So this year, your local advocates will become extremely important in making some of those connections for you. Next slide.
So oh, go ahead, Jess.
No, go ahead.
So, I think when program directors look at the applications that each of you have, are going to submit, each of the programs really has its own personality and its own way of thinking of applicants. And so to give you an example, when I was at East Carolina University, our chairman was very interested in where you went to school. Where I am now, that's not as much an emphasis. So I'd say when we look at a resident applicant, the first thing, like Jesse said, many of us will look at as a sorting mechanism is the USMLE. And I know that's moving to pass fail. So I'm not sure what we'll do after that. The other thing is each of us, I think, looks at different aspects. For me, I'm very interested in where somebody has struggled and how they have overcome. I'm personally always looking more for a blue collar guy, sort of like myself, who worked in a car wash and has made their way forward. But every program is different. So I think it's very difficult for Jen and I to, or any of the advocates here for our students, to really say, uniformly across the country, program directors have sort of a monolithic way of looking at your application. I think what I agree with Jen, what I'm looking for in a resident applicant is at 3 in the morning in the trauma bay, when the wheels are coming off, is this somebody I want to be with who is going to, perform, be able to roll with the punches a little bit. And in myself and the programs I've been involved with, research has not been a big component, but other programs are different in that. The other thing I would say is, and it says here, part 2, part 2 of the STEP, at least in the programs I've been at, we would not interview or we would not rank somebody if they hadn't taken it. So I think you have to, I think Jesse's advice of getting it done early is prudent, particularly if you may have some challenges.
Great. From the standpoint of virtual interviews, I just wanted to comment that we are all learning. And so that is the next step after you finish your application. And so virtual interviews can be a little bit daunting of a task, but we know that it is going to happen, and majority of programs have been advised to interview in that way. So hopefully we'll be able to talk about this again closer to the time of the interview process, but we have at least had a little bit of practice with this over the course of the spring, as many of our fellowship programs have started the interview process or completed even the interview process virtually. And so many of our faculty are getting accustomed to this. There are some best practices on the AAMC website as an interviewee. And these best practices really come out of some studies that were done by the AAMC related to communication and things like that, but they were able to develop some best practices based on that. And so I would encourage you to take a look at those.
Can I say something on virtual interviews, Jen?
Yes, yes.
And that is, I'd like to put the participants' mind a little bit at ease.
Mm-hmm.
The discussion of virtual interviews actually preceded this COVID experience. The reason being is the interview process is expensive. It does get you a chance to see what the inside of the hospital looks like. But to be honest, gang, all hospitals look alike. And in reality, you don't really get a chance to go around and see the community because you're usually on to your next interview. And so I would say this sounds like a sea change, but really this is a change that was starting to be considered before this virus issue. And the second is, you know, businesses have done this for years. I did 6 practice or virtual interviews myself over the winter, and it takes a little getting used to. And overall, I would say, really, with everything that you fourth years are going to go through, roll with it a little bit. You guys are much more tech savvy than us old guys, you know, who sit in libraries like this. So I think you guys will adapt to it just fine. And enjoy the process. The real portion of the interview is to get to know the people. And I think we're getting to know people a little bit better using some of these new technologies.
And that was my last point, was the challenges with commitment. Sometimes I think it sounds really hard to think about committing to going somewhere for 5 or 7 years, almost sight unseen. But I think, again, with the practice that we've had with fellowship interviews, I think that you'll see, and you also will experience, that you will be able to get to know the people. And so I think this will all work out to everyone's benefit ultimately, but change is always challenging, and especially surgeons find change especially challenging. So welcome to that club. We'll take the next slide. So these are the last 2 resources that I wanted to point out. I think finding out where to apply is always difficult. So Dr. Moore mentioned applying to 25 to 30 programs. I think that's sound advice. You may be advised to apply to more programs depending on the status of your application profile. But the NRMP website will allow you to put in your specific data and predict your probability of a match based on how many interviews you get. So I find that website to be particularly helpful as you try to make a decision about specialty choice in particular and your competitiveness. And so I would definitely take a look at that. And the other site I will mention is called Residency Explorer. And this is, it's basically a beta test, but it's an active beta test that you can have access through, again, through the AAMC. And this is compiled data from the ACGME, the AAMC, ERAS, NRMP, where again, you can put in your data and it will put you into slots with different programs and say, you know, you're in the 25th percentile of candidates that they usually match versus, If you have other data, you might be in the 75th percentile of other programs or other program types. So it can help guide you and help open you up to some programs that you may not have thought about looking at previously that you may be more competitive at. So I would encourage these two resources. Again, they're both resources from high quality institutions that are trustworthy and can help you make some decisions about which programs to take a look at.
I think also, as far as considering which places to apply to, most of you, if not all of you, are at University of such and such School of Medicine. There is a whole world out there of non-university programs as well. And one of the mistakes I think a lot of students make is they get on this train. I went to University of Michigan. I therefore must go to Michigan State University for medical school, and then I must go to, Wayne State University for residency. Academics is a state of mind. It is an approach to problem solving. It is not a location. And so some of the really better quality programs in the country are non-university based. They have the same RRC requirements. And so I would just advise folks not to think that, there's only one type of residency. I would explore both types. And I would also use the time to explore other parts of the country to see how things are done. I always think that's much better for you as a person, but also your development as a physician.
Great. That's all we have from the program director perspective, and we're excited to answer your questions.
Okay, thanks, Jen and PJ. Unfortunately, we've got some problems with our chat screen. So at this point, I know I know the original webinar was only supposed to go an hour, but I think we can extend it for another 30 minutes. So what I'd like to do is open it up to questions. I think the best way we can figure out the last second is just to, hit your reactions and raise your hand, and we'll try to figure out who answers first, and we'll just go through these 220 some students on and see if anybody has questions. So just raise your hand and we'll unmute you, and then you can ask your question. First, I can get started while the students are thinking. So, one component is that since we may not be able, since most things are being done virtually, how are students going to sort of acquire the skills that usually one assumes that they'll go to the next level during their fourth year? So when we ask each of the panelists, what advice would you tell the student to help improve their skills? Yes.
And Dr. Yang, we have a question from Maria Johnson. Maria Johnson, I'm going to unmute you. If you want to go ahead and ask our faculty your question, please do so at this time.
Mariah Johnson.
While we're waiting for her, Steve, to answer your question about how would you gain the skills, I think what Ranjan gave out, particularly the fundamentals and the the other things that the college has, the case studies, while those are not technical skills, the skill that I think that those devices, educational devices, allow you to do is develop an algorithm and some clinical thinking, which really is, I think, the hardest part of trying to put problem solving together. It's not usually the technical side, it's the critical thinking side. So I would go with what Ranjan gave out.
My advice go ahead, Dr. Troy.
Sure. Am a huge advocate for people doing non-surgical rotations in their fourth year and really taking advantage of the entire year clinically, because especially this early part of the year for many people has potentially been less clinical. And so extending some clinical rotations beyond January, I think would be a great thing. And then making sure that you fill in some gaps such as cardiology, pulmonary, or GI, some of the specialties that we work closely with and whose systems we impact positively and negatively with the operations that we do.
I would add to Jen, I was going to say the same thing about making sure this is your opportunity to be broad and learn basics from some things that you're never going to have another opportunity to do. And so the other group that I would add to that would be radiology. I think if you could spend a month doing general radiology or cross-sectional imaging, it's so critically important to what we do now. The other thing I was going to say, just in terms of a knowledge resource that's out there, I think Lawrence Essentials of General Surgery, which is written by clerkship directors from the Association of Surgical Education. I think that's a fantastic resource for the level that you are at. It's really nice and condensed. I think trying to tackle in this year something like Sabiston's or Harrison's, which is, or Greenfields, it's like this big, and I'll tell you, mine does a great job as a doorstop, but other than that, I hardly pull it out anymore. So think about those more condensed books that are really written for your level.
There's a question from Marian Safui.
Hi, Dr. Yang. I have a question. I'm a student at an osteopathic medical school, and we're being told that we don't need to take the USMLE. And I just wanted to know, from the program director's point of view, does COMLEX equate equally, or should we still take the USMLE in addition to the COMLEX?
I can answer that or give at least an opinion on that. A number of years ago, we did an entire 2 sessions at the APDS meeting on how to select the best osteopathic students for allopathic programs. I think it's going to be a little bit resident dependent or residency program dependent. The COMLEX is a lot easier to sort of understand in some ways than is USMLE, but certain states have particular rules in that regard. And to me, at least, I think you're better off taking both, even though, I understand the COMLEX scores, not all program directors do. So my advice is to do both.
Thank you.
There's a hand up from, let's try to Mariah Johnson again. Oh,
I see her.
Okay, well, Akil Gangasetti.
Yes, hi. So typically away rotations are usually done so that a student can also express their interest in that program. And that's how the program director or the residents of that program know that that student is interested. Given the COVID-19 situation, you can't go on aways. So how can a medical student express an interest in a particular program?
So go ahead.
So thanks for the question. I think that's a perception out there that that's how you express interest. But I think if you look at those data, half of residency program directors don't consider it a factor when they're selecting you to interview. So I just don't think that that's actually, I think that's a widespread feeling, and I'm not sure that that actually is grounded in truth. And, we have students, it happens every year, they go someplace because they're very, very excited. It's where they want to go. They have a great time. They hear from the program director or the faculty they're working with, boy, can't wait to see you during the interview season. And then it's 2 months later and they never get an interview from that place, and they're devastated from it. So that's why I've really gotten away from from advising that that's why you should do it, is to try and improve your chances there, because I just don't think it works that way much of the time. In terms of, to answer your question about how to express your interest, I think what you want to do, rather than focusing on expressing your interest to a specific place, I think you want to make yourself the best applicant. And so you want to work your tail off on your acting internships and your sub-Is. You want to have letters where they read them and they put down your letter and they go, my gosh, we have got to interview Akil because he's just amazing. Everybody that worked with him says that they want to work with him for the rest of their lives. That will get a program director's attention. And then you knock it out of the park on the interview. So I think that that's a much better strategy than trying to, isolate one or two programs that you think you can really go and have a significant impact in terms of changing your chances. The other thing to remember is that people are going to be distracted this summer. Faculty have things on their plate that we've never had to deal with. And so if you do go and do an audition elective, you have to understand that your chances of kind of sticking out are going to be harder this year. It's also the summertime. We have students that go and they're all excited to work with a certain faculty, and then that faculty takes 2 weeks of vacation while the student's there, and that's not something you can control. So I think your energy is going to be better suited somewhere else. But I'd love to hear what Dr. Choi thinks.
I was going to say all of those things, essentially. And in a way, rotation does not guarantee an interview at any institution. And if you are in a very special situation, again, I think sometimes Midwesterners are not looked at by East Coast programs with any frequency, depending on the program. And so there are times when sometimes a faculty phone call to the other program director might be helpful. But that still doesn't guarantee an interview. It may help them look at your application. So I think those kinds of asks of a program director have to be very selective. And so I would advise you to do that if it's a very important place that you really want to take a look at.
Great. We'll go with another question. Tashina.
Hi, my name is Tashina. First of all, thank you to all the panelists for holding this webinar and giving their advice. It's been extremely helpful. But I have a question, especially for students who are still unsure about when they'll be returning to the clinical setting. Do you have any recommendations on how they can foster relationships with their faculty members, especially during this difficult time for all of them? And how we can begin to build that relationship so that we can ask for letters of recommendations?
I think, this is PJ. I think one way, that's a very good question, Tashina. I think one way potentially to do it would be to, meet with a faculty member whom you have worked with before and solicit, their advice and talk with them about your career plans. I always think that's helpful. The other thing, if you find yourself in a position where you're trying to decide what field you want to do, or you just have a lot of questions, the advice I always give my medical students is find somebody in your medical school whom you consider wise. They don't necessarily have to be a surgeon, and sit down and talk with that person and find out, what makes a successful resident, what characteristics, what you should look for in a program. And I don't mean specifically surgery, I mean any sort of program. And because, a wise person is a wise person regardless of the question. And so I don't think if I'm understanding your question correctly, if you're trying to get it sorted out, yeah, it's good to talk to a surgeon, but it's also probably good to talk to, say, a good pediatrician or a very nice, family medicine person who you hit it off with, who you consider smart and wise. That's the advice I always give our students.
I think you can also, a lot of departments right now are running grand rounds and morbidity and mortality via Zoom. And so you could ask to be added to those meetings so that you could start attending some of those. Similarly, if there are residences that are doing journal club via remote, you can try and get involved with those. If they're doing them in person now, you could always inquire about if it would be okay if you're in the same city to go and participate in those. So those are other ways that you could explore in addition to sitting down with an advisor either in person or via Zoom.
Yeah, I've been doing a lot of Zoom meetings lately, and I can't speak to my colleagues, but we're not as busy surgically because of the pandemic. So we do have a little bit more free time, more so in the evening. But if you have nowhere to go, I would start first with the clerkship director. I think they usually can point you in the right direction with those educators in the department, especially if you're still thinking about surgery, and discuss that. A number of students and residents have come to their faculty advisors and started research projects. It's a great time to get those projects done. Those things that you always keep putting off. Well, I'll do it when I have more time. Well, we have time now. So we've been trying to get some of those things done. So, use the time wisely. It's a great time to finish those research projects or papers or start something new while we're waiting for our operative volumes to gear up. I have a question from Elise.
Yes, hi. Thank you guys for hosting this panel. I had a question. This might be kind of specific to my situation, but whenever I did rotate on surgery, I rotated on different subspecialties. And I know historically maybe letters of recommendation from other subspecialties within surgery might not have been the best thing. And so I just wanted to ask, would that still stand? Because I haven't had the time to meet with other people within the department to get a different letter.
So I agree with what Jesse sort of said earlier, Elise, and that is you want to get letters from general surgeons. You can get them from community general surgeons sometimes. I might disagree with them. I think if you've had a good relationship with the clerkship director, there's a good source. I agree with them that an acting internship. Unfortunately, I don't think a letter from a neurosurgeon or an orthopedic surgeon is going to carry weight, but, vascular surgery, trauma surgery, GI surgery, breast surgery, those are all, parts of general surgery. So those letters would be okay. I think the one exception to that rule of having general surgery letters might be if you have done, say, advanced cardiology research with somebody and spent 4 years in their lab. Sometimes a letter from an internist like that might carry some weight, but otherwise I think you want somebody from a general surgery discipline who can, I think that's just going to be better received. I'm sure others have opinions on that.
Yeah, the way I tell our students to approach this is any specialty, surgical specialty that you can get to through general surgery, meaning you can get to the fellowship by doing general surgery first, then that's game. Where you run into problems, if you do ortho, then the program directors are looking at your application and they're saying, does this person really want to do general surgery or am I their backup, right? And you want to avoid being seen as applying to general surgery as a backup. The other time where I think it's okay to get a letter from somebody who's not a surgical faculty is if you've done a significant part of your third year in a longitudinal integrated curriculum. So if you had a preceptor that you worked with for 9-10 months and you managed 30 patients on their panel and they knew you as well as your parent or your sibling, and they're going to write a letter that really can speak to you as a future physician, and they can say that it was in the context of NLIC. I think that also could be a good example of a non-surgical letter that could carry some good weight.
Okay, we've got Doug Maslowski. You're off mute.
Thank you all for your time this evening. Quick question regarding interviews, and now that they're going to be virtual, I think one of the big things about doing in-person interviews is maybe the social event the evening before and things like that to really get a sense of the culture of a residency program. So wondering what you guys' perspective may be on trying to get a good sense of the culture of a residency program via Zoom for interviews.
Can I? So I think that's an interesting question, Doug. So I know that there is some discussion out there among some of the program directors about having some sort of virtual meet and greet with the program directors, sort of like or the residents of the program, sort of like we are doing now. I think that might suffice in some ways. I have to be honest with you, and I'll probably be the wet blanket on the group. I think anytime you get a group of residents together with free food, they are going to be a happy group of residents. And so I'm not convinced yet that the social hour the night before really tells you. It doesn't tell you anything. It tells you something, I think, if it's bad. I don't think it tells you very much if it's good. But I think that the program directors and the programs and the residents in those programs are trying to think of a way to integrate you folks, who are applying to understand it a little bit better.
Carolyn, so go ahead.
Yeah, no, I've been in a few, we've had some residency cocktail hours and some things like that just through the COVID scenario. And I think they've been really effective for people to meet. You can make breakout rooms and all kinds of things in Zoom to have small groups and have opportunities for questions and getting to know each other. And so I think programs will be creative in trying to help you get to know the program because we recognize that's important.
Carolyn Brown.
Hi, yes, I definitely want to echo the thanks that everyone has been giving you guys. This has been really helpful and it's put me at ease, so I'm sure many others as well. I guess my question now is a follow-up to Doug's. I know, Dr. Moore, you had mentioned that a big chunk of residency, like the ranking list after you've interviewed, comes from what the residents, their input when you have gone and interviewed. How do you think doing virtual meet and greets would affect that, or would other aspects of your application become more important?
So I can take that a little bit just because, again, I think every program is different and how they view resident opinions. And certainly, again, the night before event maybe work more in your favor, perhaps, because we'll put you in some mixers or whatever for you to get to know people. So I think, again, every opportunity you have in the interview setting to put your best foot forward is going to be good. The night before events with virtual interviews will involve less alcohol. So again, I think that will also help both you and my residents stay on task a little bit. So again, every program is different, and we're a practical group, and we're going to take the information we have and make the best decisions that we can make. And we understand that you will do exactly the same thing. So.
Yeah, and Caroline, my input is to say I don't know what the right answer is yet. Most of us are figuring this out as we go along, just like you all are. That being said, not only are surgeons and program directors incredibly practical, they're also really, really smart, and they know that if they match people into their program that aren't going to get along with the current residents, that they've just created a whole big headache for themselves. So program directors around the country are going to figure out ways with Zoom, with breakout rooms, I don't know what it's going to be, but they're going to figure out ways to get their current residents to be involved in this process, and they're going to seek their feedback. So I don't know what that's going to look like, but I can guarantee you they're still going to ask their residents feedback. So just, I guess my advice would be get more comfortable with Zoom, be comfortable with the best practices of how to make Zoom work. Practice with your friends. I think that's really important. We do interview simulation with our advisees every single year. That's going to look really different this year, but practice it and get yourself comfortable. That'd be my advice.
Okay, Kalei?
Yeah, hi, my name's Kaladay. Thank you to all the panelists again for taking the time out to kind of put everyone at ease. I was thinking back to one of Dr. Moore's slides about letters of recommendation, and there was I think it said ideally not getting clerkship, letters from clerkship rotations and focusing more on acting internships, sub-Is. Is there any particular reason for that? And would you, I guess, change that recommendation given that we may not be able to go on as many acting internships given the COVID-19 situation?
So the reason I usually advise that is that I think that your role as a clerkship student is really different than when you're an acting intern. When you're a clerkship student, you're often really focused on studying for the shelf exam. You're just trying to figure out the culture of a surgical team. You're trying not to touch the wrong things in the operating room. And so there's a lot of growth that happens during that rotation for students. And you're also usually being moved around pretty quickly through different experiences, and you may not be able to really work with one faculty or one group of residents for a long time and really demonstrate your skill set. An acting internship, there's much less focus on you preparing yourself for an exam at the end of it. You generally are going to be given a lot more responsibility. A lot of programs look at an acting intern the same exact way that they do an intern. I operate on Thursday mornings. Our residents are all in conference on Thursday morning. That means that until noon on Thursdays, I operate with an acting intern. I never do that with a clerkship student. And so that gives me a real opportunity to see what they're like in terms of their technical skills, their comfort. And so there's just different opportunities. So that's why I traditionally say that. That being said, I do think that because some students are not going to have the opportunity to do as many rotations, I think program directors are going to be more accepting of a letter from somebody who worked with the student during the clerkship for 2 weeks or 3 weeks and can really speak to that student's abilities.
Thank you.
So we're going to do 4 more questions. We got Kevin, Patrick, Annalise, and Haley. So Kevin, you're unmuted.
Thank y'all for doing this. I got a couple of questions. Since interviews, one, okay. Since interviews are moving to possibly online, are y'all expecting changes in the numbers of interviews that you guys will be offering to applicants?
We don't know yet. I think we are all a little bit hopeful they wouldn't change to online, but I think everyone's still in the process. But my guess is no, that we'll all continue to do the same number of interviews, but I can't speak to that. It will be harder to do the huge interview days. My institution does 8 small interview days, but the people that do 2 days of 30 or 40 people, that'll be really challenging with Zoom. So I think there's more to come. All that planning is still in the process.
Thank you.
Yeah, my guess is that, well, I think people will say, well, I can apply to more programs and interview more, but I think that the number of granted interviews are still going to be the same. So I don't think they're going to be doing more interviews.
It's going to be the same amount or more work, honestly, administratively, to put together an interview day this year. And that's, so capacity, by the time we get to October, November, presumably our surgical volumes are all back up. So I would be surprised if programs are doubling or anything like that. It's probably going to be about the same.
Okay, Patrick Arpin.
Hi, good evening. Again, thanks to all the panelists for your time tonight and for kind of walking us through how things are going to change. So this is maybe a follow-up to Kaladi's question, but for students like myself who are at programs that don't have a home surgical residency program, and we traditionally rely on the sub-Is and OAs for letters of recommendation. Dr. Moore, I know you kind of talked about perhaps we're going to use the clerkship letters in lieu of those, but do you have any other advice how we can fill the gap for getting good letters?
Well, I guess, so Patrick, are you saying you're not going to have an opportunity to do an acting internship or a sub-I?
That would be dependent. Basically, if VSAS or the away or a sub-internship applications open again and programs do take students, then yes. But if not, most likely not, no.
So you could only do a sub-I or an AI by doing a visiting student rotation?
Correct, yeah. Yeah, I go to a school that doesn't have a home surgical program.
Okay.
So this is PJ. Patrick, that's a unique question because there are only about 4 medical schools in the country, or at least allopathic medical schools in the country that have that situation. So you are a little bit unique in that regard. My advice to you would be, anything you can do to set yourself up in a community rotation, which would act in many ways as Jesse described, you're one-on-one with an attending. That will give you, I think, a really good opportunity to A, see what surgery is like, and B, to achieve well and, get a letter of recommendation. That would be my advice. Because your school would probably have some means of having a 4th year rotation. The other thing to bear in mind is as those rules came out about away rotations, one of the stipulations in those rules about not allowing away rotations is that they should be allowed for the unique situation where you don't have that ability to have that clinical experience at your own institution. And so you might have a little bit of leeway, Patrick, on that. But you're in a particularly unique situation, but the powers that be thought of that situation, and you still may be able to go out and do some, because you fall in a little bit different category.
Okay.
Great, thank you.
Annalise?
Hi, everybody. Again, thank you all for hosting this panel. It's been super helpful. My question is, I've heard that there can be kind of a regional preference with residency applications, and that it can be hard for students sometimes to break out of their region and go somewhere different. I go to school in the West, and I'm really interested in a lot of programs in the Midwest and on the East Coast. And so I guess my question is, one, is this regional barrier a real thing? And how can students demonstrate that we're willing to move across the country without, proving that we bought a plane ticket for an interview and things like that?
So I know Jen spoke earlier about some of the regional differences. So I'm certainly interested in her answer to this. What I would tell you, Ainsley, is I think we live now in a global world. And I think that I'm not sure that is as big a problem as it used to be, particularly given the fact that medical students are applying to more and more programs. And so I'm not sure that's as big a problem traditionally as it used to be, number one. And number two, I'm not sure you traveling across the country is going to make or break your impression that you make. Having been in 2 regional areas, I never looked once at where did the person come from. That wasn't part of my own calculus. Maybe it is for Ranjan or Jennifer.
No, I think you're right. I think anymore it's your qualifications, and you can certainly in your personal statement indicate why you're interested in a particular program. So, I think if you've got the qualifications and if you've got a desire to be in a particular geographic area, that's an opportunity for that to come across, and also in your interviews. Oh, by the way, sorry, Jen.
That's okay.
One of the stipulations also in this virtual interview process is that we're trying not to give people who are local any advantage over those people who are in distant places. So we're trying to level the playing field as best as we can. And with regards to that, some of you have said, how do we really get a sense of the personality of the institution? It's amazing. We just finished our fellowship interviews for minimally invasive surgery at Duke. And it's amazing how both come across. Our personality in the conversations that we were having was clearly coming across to the applicants, but the applicant's personality was also coming across pretty clearly to us. And we could easily identify people we would love to have just because of their personality, or people we would absolutely not want to have, again, because of those little nuances. So I think Jesse mentioned this. Honing your interviewing skills, learning what to do and what not to do, particularly if you're interested in a place, is going to be extraordinarily important. Sorry, Jen, go ahead.
So my comments on the regionalization issue really comes from some of our students from Indiana. So when they grow up in Indiana, undergrad in Indiana, med school in Indiana, sometimes I have challenges getting them to programs outside of the Midwest. And because I think there's a particular perception perhaps of Midwesterners. I don't know how to break that completely, but Dr. Sam made a good point that you can individualize your personal statements. So if there is a particular program and you want to modify it just even the slightest bit to demonstrate your interest in a region or a particular institution, you can modify your personal statement for that. And then the last thing is, again, I would agree that I particularly interview from all over the country, and I have really enjoyed that. It's brought some diversity to our program. So, looking for regional diversity, gender diversity, racial diversity of all types, I think really adds to a program overall. So.
That's creepy. Yeah, one area where we've not touched upon gang, which might be important, or at least a question for some, is the personal statement. Jesse had it exactly right. That is, much of this is under your control, and your personal statement certainly is. It's a chance for you to talk uninterrupted. So if you have a blemish on your record, or you want to express that you're trying to explore, New York City as opposed to Portland, Oregon, you have free reign to do that. And I think many of us program directors like that sort of a personal statement that really talks about you better than the personal statement that starts with, I didn't know what I was going to do with my life. And then one day I went to the trauma bay and whoa, there I was. I don't think any of us really believe that. And so use your personal statements wisely.
Okay, the last question goes to Haley.
Hi, my name is Haley Eubanks, third year at VCOM Auburn. And it's a step away from the application. I think it has something to do with it because next year our lives will be changed dramatically, being that we are in unprecedented times. So I would like to ask, since we are applying and we are very passionate about being surgeons, how has your surgery residency program been shifted by the COVID-19 virus? And are you looking for particular characteristics to show up in an application now due to what we're experiencing now? And what can we expect when we graduate next year as new surgeons?
So can you just restate where you are in the process?
I am a third year at VCOM Auburn. Okay,
so you're a third year medical student?
Yes, sir.
Oh, I got you. Okay. I'm sorry, I was confused. I'm not sure. I know I'm not smart enough to answer that question as to what the world is going to look like afterwards. I think that the American Board of Surgery has made some adaptations to case requirements and index case numbers. But at the end of the day, those are pretty marginal. And I think the the experience is going to, I think, for the most part, remain unchanged. I think there may be some minor adjustments, but I think for those people going in as you would be, really not next year, but the year after, I think I think it will probably be you know, very, very similar to what has happened in the past. At least that's my projection.
Haley, I think I heard your question differently than Dr. Schnartz. I think I heard you asking what are programs looking for in applicants given that COVID has happened and has changed the world. So I'm gonna answer it that way, and you can decide if you like PJ's answer or my answer.
Yes, either, yes.
Yes, and okay. So, and I'm not a program director. I should say that very clearly. I'm not a program director. I have participated in the process up here at the University of Vermont for the last 9 years. So I've read a lot of applicants and done a lot of interviews. And I think what probably we have seen, we have always known that we need people who are going to be having an excellent work ethic, great team members who are going to take care of each other, look out for each other, who are resilient and who are able to roll with the punches and adapt to change, right? That's something that we have always wanted in our colleagues for the future. And I think that COVID-19 only underlines that even more. So I think to me, it's those things. It's teamwork, it's resilience, ability to adapt, and looking out for each other.
Jesse's answer is better.
It's okay. I like them both. Thank you.
Well, I'll say, I like both of their answers better than mine, but I think we will see a dip. I mean, I sort of project that we won't be doing as many cases because, people have to get back to their lives, their economies, their families, their jobs, and they may not put their health at first priority. So, again, it's very difficult to foresee the future, but, what I've seen in the residents here, as much as everybody has said, the resiliency, the grit that everybody talks about, where one would think, well, I'm afraid to go to these units, and you hear about residents who don't feel that they're prepared enough, but I tell you, the residents here are just stepping up. I mean, they want to be working on the front lines. The faculty, I'm a thoracic surgeon, but I work covering the ICU a bit, doing procedures. So we're all pitching in because, as I said earlier, this is the profession we picked. Maybe just in closing, I'll just say that, I find that surgeons are probably the best physicians in finding solutions to adversity. We do this day in, day out, in the operating room, outside the operating room. You'll see all the innovations that everybody's talked about, how we've sort of transformed the interview process and our daily conferences as such. And so, I think, we will overcome this. When I think about some of the aphorisms that we use every day, we adapt and overcome. As Jesse said, change is good. We've always talked about going virtual. We're doing telemedicine visits. So those are some of the things that the students and the residents should learn how to do, because we know how to do telemedicine and we've been talking about it for 10 years and now we're sort of forced to do it. So chaos brings opportunities. We've got great new opportunities to explore, but we shouldn't forget the things that we've done in the past. So, we understand the constraints that you currently have, the lack of personal face time with mentors and inability to do away rotations and distant patient contact. And some of you are still trying to decide whether you want to be a surgeon, but hopefully, after tonight, you see, we're still gung-ho in this. We've taken a bit of a breather from our day-to-day, which in some of us, it's been great. It's just to clear our minds and rethink about life. But, surgeons really come up with the answers. We may not have had definitive answers tonight, but hopefully, that all of us are working hard to find solutions. But mainly, the purpose of this webinar is to make sure that, you all are our surgical future. We want to keep you engaged and inspired in our specialty. So I want to thank all the panelists again for speaking tonight, for their time and their efforts they've spent the last couple weeks on working on this webinar. I want to thank Dr. Sachdeva again for the opportunity to do this, and then to you all students for coming and hanging on. I know we started about over 200 and 171 of you are still, so we thank you for the hour and a half of the evening that you've given us. You know, tell your colleagues how you thought about this. We're going to do this again on Tuesday. Please fill out the post survey, because if you feel this was useful, we would love to do this again. We sort of love to do this on a maybe a monthly or bi-monthly time schedule. We hope to see you at the Clinical Congress in October. We're planning a great 3-day medical student program. Those of you who've been in before, or go to the website. It's always popular. We have over 400 students to go there. We'll be going through some of the COVID issues again. Hopefully we'll have better times, and we'll have more solutions for you. So again, thank you all for coming. You all stay safe, you stay healthy, and we'll look forward to seeing you together soon in person.